the heart stops. Okay? The heart stops. Cardiac arrest, you're dead. Okay? I'll get to that in a minute, don't you worry. I know you're absolutely dying to know. Right, so cardiac arrest. Okay? Right. Let's start as nice and simple. Does everybody know that you have 4 chambers in your heart? Did we all know that, yeah? Have you done any anatomy as part of the healthcare setting yet? Yeah? Okay, good stuff. I would have imagined that there is some amount of anatomy that you have to know. Okay, brilliant. So you have 4 chambers. What are the 4 chambers called? So you have left and right side with atriums and ventricles. Brilliant. Okay. So here is a nice crude drawing of the cardiopulmonary system. Okay. As I'm sure in your books you probably have an anatomical picture of the heart, which sometimes can be a little bit complex for people to learn. Okay. This here is a diagram that I use from first aid up to paramedics to train the cardiopulmonary cycle. It makes it really easy. What is the job of the heart in the human body? Good. It's a pump. That's all we need to know. Let's keep it nice and simple here. So, it's pumping all day long doing that. Closing chambers, opening chambers. Did we know that, did we? Well, we know about chambers, so we'd assume that you know that they close and open, push, blood out and in, yeah? Yeah, cool. Look guys, I need to know what you know and what you don't know. It's not a test, alright? Honestly, I need to know what you guys know, because if you don't know, I'll fill in the gaps for you, no problem. Yeah? And it'll definitely help you understand this stuff. And especially again when the time comes to know the difference between a cardiac arrest and a heart attack. It's kind of nice to know. Alright? So in cardiac arrest, you'll find like that, the heart is doing this all day long. Always. Your heart is doing this all day long. What makes your heart beat? Who said that? Pacemaker. Okay, tell me more.
It's like a little dog, basically. It's on the left part.
Good on you. Yeah. Did everybody hear what she said? No? Yes? In your heart, you have 2 internal defibrillators in everybody's heart. You have one at the top and you have one here at the bottom. Okay? They're organic in nature, obviously, they're not metal or synthetic. But what happens is, these little things here send out electric shock across the heart. First across the top. Has anyone ever seen those machines that people put on their stomach to lose weight? It sends an electric shock in the stomach, tenses like that. Have you ever seen that before? That's what's going on in your heart every single day. An electric shock goes across the top of the heart, causes it to contract, close out the chambers, to force blood out, or downward should I say, okay? Send the signal down to the bottom one, and then the bottom one does the same thing, contracts and sends blood out. All day long, right? That's a normal cycle of your heart. In cardiac arrest, what happens is, that signal goes completely distorted. So it goes from nice and normal into this chaotic, unorganized mess. It's literally just electrical signals being sent everywhere. But it's in spasm, which now means there's no blood going into the heart and there's no blood going out of the heart. So the pump has stopped working. So where's the patient going to be? On the floor, dead. Okay? Now, if blood stops pumping around the body and they're on the floor, what colour are they going to go? Blue, purple, green, yellow, all the colours of the rainbow, depending on how long they're there, trust me. Alright? That'll be important in a minute when I cover like compression and stuff, okay? So they're dead. Alright? Because the big thing we find with CPR is people, we'll see it later on, when you go onto the mannequins, people are like, I'm like, what's wrong? Oh, like, you know, I don't want to hurt them. They're dead, alright? You can't do much more damage than that. So let me tell you something, right? Has anyone here ever heard of an ECG? Yes, electrocardiogram. A lot of sticky dots on your chest, and it shows us what your heart is doing. For anyone that's watched TV or a movie, I guarantee you've seen that on the screen somewhere. Okay? You typically see that. In cardiac arrest, it looks like that. As you've seen in the DVDs there. Unorganised, completely chaotic, and nothing's going on. Has anyone here ever heard the term, you got out tonight? Yeah, but you don't out. Have you ever heard that term before?
Yeah.
Hello? Welcome back to the real thanks. Right, we've heard the term you're going out, but I'm not going to go out. That's dead, and that's dead. That's a fact. That is exactly what it is. That's dead, where we're going to try and fix it, and that's dead. So cardiac arrest is an electrical problem. What device do we use to fix the heart? Good on you, defibrillator, brilliant. They're also called AEDs. You see them dotted all over the place. Tesco's, Lidl's, Aldi's, whatever. Does anyone here know what AED stands for? No. Do you know what you're on did? Good man. Huh? Stands for Automated Electrical Defibrillator. Automated electrical defibrillator, isn't it? Yeah, it is, yeah. I'm doubting myself for a second. Yeah, automated electrical defibrillator. Alright, AED. Or is it automated emergency defibrillator, maybe?
External.
External. That's it, sorry, bro. Automated external defibrillator. Drew a blank there, what I say about that? Automated external defibrillator. External because it's outdoors 9 times out of 10. But come here, they're automated, meaning that they're voice prompting. You heard the DVD. They're designed for untrained people. You're going to be considered to be trained at the end of this. So when you switch it off, it tells you what to do. And when you're putting the pads on, you're like, Jesus, what goes where? There's pictures on the back of the pads to show you where to go. So if I catch anybody later on putting the pads in the wrong place, I'm going to stick them to your cheeks. I'm not joking. Not joking. There's pictures to show you where to put them. They're designed in a way, guys, that any member of the public can use them. That's why they're designed that way. Automated. Tell you what to do, okay? When the pads go on, they're analysing, as they just told you in the DVD. They're analysing to see where that patient is at. Which electrical rhythm is the body in right now. If it detects this, which is normal, obviously it's going to be no shock advised. If it detects that, it's going to be no shock advised because there's no electrical rhythm in the body. This here, shock advised. It'll send a shock, right? The pads go on here and here because it sends the electrical shock from here to here, through the body, through the heart, through your two internal pacemakers. And what it's doing is, it'll pick this up, shock it to get rid of it, erase it, momentarily putting you here, but as soon as the shock goes in, you need to immediately commence compressions to try and help the heart restart back up here. Okay? Now, I think personally, right, everybody knows it as a defib, no one knows what AED, and no one obviously knows what AED stands for. I can guarantee you, if we call this party restarty, you definitely know what it is then. Because that's exactly what you're doing. You're restarting the heart. Okay? An AED is to restart the heart in the correct sequence, back to normal. Okay? Now, tell me about compressions. How many compressions to breath did we used to do? 30 compressions to 2 breaths. Brilliant. Right? That's the ratio of compressions to breaths. Now, during COVID, in COVID, whatever, alright, you people are being told, don't put your mouth on anybody for obvious reasons and infection control. However, even before COVID, we're teaching a long time, guys, we still told you, don't put your mouth on a stranger. Because when you covered infection control with us, we already told you, you go on the premise that everybody's infected anyway. Because COVID is just one. Bird flu, swine flu, Ebola, HIV, fucking hepatitis, there's loads of different things out there. You don't know what people have, so you would never put your mouth on a stranger anyway. Who do you think you would most likely put your mouth on? Family alike. It's not fair. Well, just family, do you know what I mean? I don't know about you, I hate your family. What? Yeah, partner, family, kids, people like that, absolutely. In that circumstance, it is probably acceptable for you then to put in your 2 breaths, let's be honest. Whereas a member of the public, what I'd expect you to do is do 30 compressions and reopen the airway. I've showed you this morning why the importance of it, okay? When you're doing CPR, you're pushing under the chest, you're pushing the heart closed, okay? But you're also forcing the lungs closed. And studies have shown, as long as the airway is open, air will go out, but air will also get sucked back in, as long as the airway is open. So do 30 compressions and just reopen their airway. Because by pounding on their chest, the head will naturally come back down here and close off its own airway. So at the end of your 30 compressions, just reopen the airway and go back into compressions. Now, do you have a question?
Yeah, and you know the way you talk, listen to people while using like putting around with you, like a little varsity, you know, the vampire. So
Yes.
what's the one that-
Barrier device, keyring, yeah.
Yeah, so you're doing that.
No, I use, do you know where I use them still? On my family. Members of the public, off me, get absolutely nothing, only compressions, unless I'm working on an ambulance. For me to touch somebody's airway, guys, especially nowadays, I have to wear a full onesie, I have to wear a respirator, goggles, 2 pairs of gloves. So if I'm wearing that to touch somebody's airway, do you think that little piece of plastic's enough? Absolutely not. Yeah, so what I'd say is, even by doing compressions, and even though you now know that they're dead, I would still cover their face by putting a mask on them. Okay? It might seem stupid, but by pushing on the chest, you're forcing air up. And you don't know, is COVID the reason why they collapse and died? Understand? Or any other infectious disease for that matter. So cover their mouth anyway. But no, I would use them for family members, because 9 times out of 10 in CPR, you're always going to get peas and carrots. Peas and carrots meaning, guys, by putting air in, you'll distend the stomach. It always collapses and it always comes up this way. So using a barrier device is probably preferable to whatever it is a family member. Because let's be honest, it's probably not going to taste very nice tasting their peas and carrots. Alright? You can let me know what happens. Alright? But yeah, there are reasons why I use a barrier device. Now, 30 compressions to 2 breaths, family. 30 compressions, opening the airway for everybody else. Okay? Now, how many compressions do you think you should be doing in 1 minute? I'll give you a hint, it was on the screen. 100 to 120 compressions.
Is this the same for the child?
Yeah, I'm going to put that now as well, alright?